please text 250-216-9890. Again, if you are on the line but having technical difficulties getting into the question queue, please text 250-216-9890. Media will be limited to one question and one follow-up. With that, I'll turn the microphone over to Lisa Lapointe. Lisa.
Good morning. Thank you for joining us this morning for the release of the Death Review Panel report into heat-related deaths in BC in the summer of 2021. We are sharing this report today from the territories of the Esquimalt and Songhees First Nations, who have been resident and stewards of these lands for centuries. I am grateful to be able to work in this beautiful area. In the summer of 2021, BC experienced a heat wave unlike any experienced in recent or remote memory. In the week from June 25th to July 1st, 2021, when the extreme temperatures were experienced, 815 deaths were reported to the Coroner Service. The average number of deaths reported that week in the previous 5 years was 198. As deaths due to environmental heat are externally caused, they are considered accidental deaths as per the International Statistical Classification of Diseases, and are therefore reportable deaths under the BC Coroners Act. Ultimately, the Coroner Service determined that 619 people died in BC as a result of the heat dome. Under the Coroners Act, the Chief Coroner has the authority to establish a panel to review the facts and circumstances of deaths in British Columbia for the purpose of providing advice to the Chief Coroner respecting medical, legal, social welfare, and other matters that may impact public health and safety and the prevention of deaths. I directed a death review panel into the deaths that occurred as a result of extreme heat. Panel members included representatives from the Ministry of Health, the Doctors of BC, Health Emergency Management BC, BC Emergency Health Services, the Office of the Provincial Health Officer, the First Nations Health Authority, the Vancouver Police Department, Simon Fraser University, BC Housing, and the BC Centre for Disease Control, and the City of Vancouver, as well as representatives from the Coroner Service. The panel was facilitated by Mr. Michael Ailson, formerly chair of the Coroner Service Specialized Death Investigation and Review Unit, and now most recently retired. The heat-related death review panel was convened to better understand medical, legal, social welfare, and other matters with respect to heat-related deaths, to provide advice that may impact public health and safety and prevent future deaths. The review included a review of the Coroner Service investigative findings, existing academic and research literature, additional information provided by panel members and their partner agencies, and recommendations were developed in a manner that was collaborative, significantly attributable to the deaths being reviewed, focused on the greatest opportunity for improved public safety and death prevention, and targeted to specific parties. They were realistically and reasonably implementable and measurable and limited in number. Panel members are advised that they must execute a confidentiality undertaking and are asked to contribute their experience and expertise in helping the panel offer advice around heat-related deaths to the Chief Coroner. I would like to take this opportunity to express my sincere thanks to all of those who participated in the panel and shared their experience, knowledge, and expertise. It is imperative that death review panels include a broad and diverse range of voices and perspectives, and I am sincerely grateful for the wise voices that participated in the heat fatality review. Dr. Jatinder Baidwan is the BC Coroners Service Chief Medical Officer and was a member of the death review panel. As Michael Ailson is currently enjoying a well-deserved holiday in the UK, Dr. Baidwan will present the findings of the report on his behalf.
Good morning. In late June 2021, British Columbia experienced an unprecedented heat event that resulted in record temperatures across many parts of the province over several days. Temperatures began to rise on June the 24th and continued increasing to a peak on June 28th and 29th. At the peak, temperatures reached over 40 degrees Celsius in many parts of the province. Overnight temperatures also remained uncharacteristically high throughout this period. During the week of the extreme heat event, the British Columbia Coroners Service responded to a sudden and significant increase in deaths. More than 800 deaths were investigated by our agency during that week. Additional deaths attributed to the heat dome were reported in the following weeks. In total, 619 deaths were determined to be heat-related. Before I speak to the panel's findings, I want to remind everyone that each of the data points we are about to discuss represent a human life. The people who died were people who, for a myriad of reasons, were overcome by the effects of extreme heat. Most lacked access to cooler buildings or air-conditioned spaces. Many were older adults who had chronic health conditions. Many had communicated that they were feeling unwell and were having difficulty managing in the hot conditions that we faced. Compared to the BC population, heat-related deaths were higher among persons of specific chronic disease registries, including schizophrenia, substance use disorder, epilepsy, chronic obstructive pulmonary disease, depression, asthma, mood and anxiety disorders, and diabetes. More than 60% of decedents had seen a medical professional during the month prior to their death. 67% of decedents were 70 years of age or older. 56% of decedents lived alone. Compared to the BC population, more decedents lived in socially or materially deprived neighbourhoods. Most decedents were in homes which lacked adequate cooling systems such as air conditioners or fans. 74% of deaths occurred in communities covered by Fraser and Vancouver Coastal Health Authority. By health service delivery area, Fraser North, Fraser East and Vancouver had the highest rates of death. 911 calls doubled during the peak of the heat dome. The median time within which paramedics attended scenes, 54% of deaths were 10 minutes and 25 seconds. In 50 instances, paramedics took 30 minutes or longer from the time of call to scene attendance. In 17 instances, 911 callers were placed on hold for an extended period of time. In 6 instances, callers were told that there was no ambulance available at the time of their call. After discussions related to the review of these deaths, the panel identified 3 key areas that could be addressed to prevent such devastating loss of life in the future. A coordinated heat alert response system, otherwise known as HARS, ensuring that vulnerable populations are identified and supported during extreme heat events, and implementing preventative and adopting longer-term risk mitigation strategies. The panel's first recommendation is to implement a coordinated provincial heat alert and response system, or HARS. Panel discussions identified the need to establish clear provincial protocols and outline actions to be initiated when either a heat warning or an extreme heat emergency alert is issued. The panel recognized the need for overall provincial coordination since, like other natural disasters, an extreme heat emergency event is a provincial emergency and may require access to additional services. The panel also identified the importance of regional and local decision-making, as this is where the best understanding of the needs of local communities exists. Extreme heat emergency alerts must trigger regional and local level action plans. The BC Health Effects of Anomalous Temperatures, otherwise known as HEAT Committee, has been working on many of these coordinated strategies. Clarity regarding who should act as a lead agency in coordinating planning and action is also required. Coordinated planning should ensure that the agencies are aware of impending heat events which would trigger agency action to address needs such as surge planning of staff and resource allocation. Extreme heat emergency alerts must be paired with clear protocols to ensure no time is lost in responding to a heat emergency. The protocols must recognize the seriousness of the emergency and the potential for a mass casualty event. The panel's second recommendation is to identify and support populations most at risk of dying during extreme heat emergencies. Not all people experience the same level of health risk during the extreme heat event. The elderly, persons with chronic health conditions, persons living alone, those with no access to cooling, and those in particular geographic areas were more impacted. Wider public awareness and community-specific training on how to recognize heat concerns is necessary. Universal safety measures and warnings are required for all British Columbians when an extreme heat event is occurring, but some populations will require additional intervention, support and assistance. One of the challenges is identifying who is most at risk and how to adequately meet their needs. Two of the most impactful interventions during a heat event are ensuring people have a way of staying cool either inside their residence or elsewhere, and conducting informed checks on older adults, persons with health conditions, those living alone and those with mobility issues, to consult and work with them on their well-being and support needs. Any successful strategy must include the perspectives and stated needs of those most at risk of injury or death from extreme heat. In some areas with higher material deprivation, the number of deaths was lower than may have been expected. Decision makers must engage with and learn from people living in those areas to understand the ways they successfully supported their neighbours. Lived experience must inform community strategies for prevention from planning through implementation. Many decedents had recent contact with medical professionals. Leveraging these contact encounters could provide an opportunity for education on the impacts of heat and assessing any additional health conditions that may place patients at greater risk of heat-related injury. The panel's third recommendation is to implement extreme heat prevention and long-term risk mitigation strategies. Adaptation and risk mitigation become more urgent with increasing likelihood of more frequent extreme heat events due to the impacts of climate change. Discussions focused on the importance of increasing shading and heat reflectivity and reducing evaporation as natural cooling measures to help mitigate the impact of future extreme heat events. Increasing green space and shading, especially in neighbourhoods high on the material deprivation index, would provide naturally cooler areas where people can find respite from the heat. Building codes that require passive and active cooling, retrofitting codes, and designing and implementing rebate programs that encourage active and passive cooling in current housing stock, especially in materially and socially deprived areas, would further mitigate the impacts of extreme heat. Current building codes in British Columbia do not consider cooling in the same manner as they consider heat. As codes are revised, they will need to reflect the latest climate science and our reality that we face. Data collection on the circumstances surrounding heat-related mortality and morbidity is important to help communities identify those most at risk and neighbourhoods to support evidence-based decision-making for community planning. In closing, I would like to take a moment to recognise the role we all play in building resilience against a future extreme weather event. We must recognise the threat that extreme heat poses for all of us and respond accordingly. Please familiarise yourselves with warning signs of heat stroke, which include headache, nausea, dizziness, weakness, irritability, thirst, heavy sweating, elevated body temperature. That's not an exhaustive list, but I think it's out there and everyone understands what these symptoms are. Have a plan to check in with neighbours and loved ones and adhere to the plan. We know that future heat events like last summer's are certain to occur. Together we can help ensure that we are ready to respond and avoid eminently preventable loss of life. On behalf of the panel and the BC Coroners Service, thank you.
Thank you, Taj. A reminder to reporters to please press *1 to enter the queue. We'll start in the room. Our first question today is from Richard Zussman, Global News.
I'm trying to understand in the report here, there's a mention of a lag between heat alerts and the public response. Whose responsibility is it there? Is it the public that did not listen to the response? Was the response not strong enough from Environment and Climate Change Canada and public agencies? Like, what caused that lag?
So Richard, that's a very astute sort of pickup that you've made there. At the end of the day, the answer is all of those things. The panel considered all of the different sort of factors that were at play, and essentially people didn't take it as seriously as they thought, as we perhaps now think we should have taken it, and we're all guilty of that. You know, there was also some lag related to agencies that weren't ready. And that's what a lot of the work at the Death Review panel was about, trying to work out a way that we can actually put alerts out there and actually get a cascade of events that then takes place from that alert, which will ensure that the deaths that we had last time around didn't occur. I mean, essentially, if you think about it, people dying from heat, it's a failure of the way that we live. It's not a failure of the health system, it's a failure of the way that we live. And it's the more burden we put on the health system at times like this is more of a surrogate of how badly we failed in the way that we're actually sort of planning our cities and our homes.
And to that point, I assume we'll hear at 1 o'clock the government's going to adopt many of these recommendations, if not all of them. One of the big pieces is about building our future homes. How critical is this piece of ensuring future homes have air conditioners or fans? And does there need to be an interim measure in place where we can get those products to people in essence immediately?
Yes to all of that, and I would also add, those that can't be, if we can't get something to somebody, we can actually take them from where they're at risk and put them somewhere where they're less at risk, in a cooling centre or whatever. So the central crux of the answer that I'm going to give you is that the second recommendation that the panel came up with essentially is directed exactly at what you're saying. It's to actually sort of get people the help they need, either in the living space they're in, or actually take them somewhere where they're not going to succumb in the way that they would in the living space. And then the third recommendation is all about the sort of the first part of what you were saying. It's about making sure that we take active measures to ensure, we historically live in an area where we worry more about heat, and we worry about sort of keeping the heat inside the building. And now that's kind of biting us. And so essentially we have to turn around the way we look at things to make sure that we're able to cool our buildings effectively as well as heat them up.
Our next question today is Binder Sajan, CTV.
Hi there. So I just want to go back to the communication piece that Richard asked about. I'm having a hard time understanding. So it sounds like many of the people who died knew that they were feeling unwell, couldn't get access to cooling. How would that communication piece have helped them, you think?
So Brenda, at the end of the day, if someone knows that they're about to suffer the effect of heat, then they can ask for help. They can actually get sort of those that love them to come and support them in some way. They can ask for other agencies to help them. If someone doesn't understand that heat is about to sort of be a real important factor in their lives at that moment, then they're not going to personally start down that cascade of events that could make a huge difference to their journey in the next days. So that's what a lot of the work has to be around. Now you have to, the most important thing, and that's what the Death Review panel sort of addressed, was that you have to identify who these folks are. We all kind of know who they are because we live next door to them. But how many of us, hand on heart, actually took the time to go and knock on someone's door and ask them if they were okay? How many of us actually realized that there was an actual significant heat event actually going on? Most of our thoughts are about sort of getting to the beach and enjoying the sun. Doing the things we want to do outdoors, because inclement weather in BC is not something that's, we have it all the time, and it's nice to get a bit of sun. So we didn't understand that there was risk associated. And that, I think, is the part that we're going to be able to sort of address by public messaging, by the alert system, by, just having agencies ready to sort of, go down a cascade. One of the things that when you are responding to events like this, nobody wants to trigger a false response. No one wants to spend, lots of money, lots of public money on a response that's not going to make a difference. So you have to be very careful. You have to balance that up against the fact that, you do need responses that are effective. And I think the recommendations that the panel made, and we've seen the announcements yesterday, I think those recommendations are already coming into fruit.
Yeah, just thinking about, just the sheer number of people who died, it's pretty tragic thinking about all of that. I noticed in the report the recommendation is to have a review done into whether cooling equipment can be given to people in need as a medical device by December 2022. Why do you think it's going to take that long? I guess some people might say, why not have it done as quickly as possible?
So I think the panel didn't say we need to give medical devices to people. What the panel said, and quite wisely and quite correctly, is that you have to identify people that are vulnerable, people that are at risk, and then you have to ensure that they've got adequate ability to use cooling, either in the place that they live, or if you can't manage that, you need to take them somewhere else where they can be cooled. So there'll be some loss of personal autonomy if that happened, obviously, but But on a balance of risks, that's probably the right thing to do. And the latter part of your question, why does it take the time to do anything? I mean, we all know the answer to that. At the end of the day, this is not it's not a simple matter of sorting out something, for 3 or 4 people. This is, the magnitude of this. The magnitude's huge and vast. And so really it's about changing the way that we live and choose to live. That's going to take time. But I think, we've tried to be pragmatic. The panel tried to be very pragmatic about putting reality into the dates that we chose for implementation. And I'm grateful to see that some of it's already been implemented. I mean, it's starting to happen. We had that announcement yesterday, which tells me that that people are paying heed.
Our next question today, Dirk Meisner, Canadian Press.
Hi, do you think with what we know now and with your report and the recommendations that it would ever happen again in British Columbia where more than 600 people will die in a heat event?
I guess this morning I must have left my crystal ball at home because I can't answer that question. But I understand why you asked the question. I think it's about eliminating risk. You are never going to live in a society where you eliminate all risk, but we have to do our utmost to ensure that we absolutely actively eliminate as much risk as we can understand. And I think the recommendations that we make are really sort of near-term recommendations that will help eliminate risk today. There are longer-term and medium-term risk mitigation measures that are going to make sure that we build societies and communities and build our homes in a way that's sensible as we go forward. So I think we are going to be able to mitigate a huge amount of risk. Can I guarantee that it's never going to happen again? Absolutely not.
I also wanted to, and I think you just touched on, you talked about earlier building codes, and I think you said we do not consider cooling in the same manner as we do heat. What do you mean by that?
So traditionally, we're in an area where we worry more about people sort of succumbing to cold weather, and that's traditionally been what we've always thought about. If we look at our building codes, you'll have R values that tell you how much insulation you're going to put in walls, and et cetera, but very little is written about how you cool and actively cool and passively cool the buildings and structures that we choose to live in. Even simple things like how do sort of urban heat islands make a difference? How does tree canopy how does that reflect off heat? All of these things make a huge difference. There's a huge amount of science that's available to us, but it hasn't made its way into our building codes up to now.
We'll turn to the phones now, and our first question comes from Justine Hunter, the Globe and Mail.
Thank you. I just want to bounce off Dirk's question there, and a little more specifically, are we better off today than we were last June in terms of the preparation that agencies have? The government has made some announcements around changing the number of paramedics available and the heat alert system. Are we in better shape today?
Absolutely. I can honestly say that we are in better shape today than we were at the time of the heat dome last year. Are we where we need to be? No. Can we get better? Absolutely. Have we now got a roadmap to get us to where we need to get to? Yes, we have. Are we going to do all the things that those recommendations say? I do not know. But I do know that the Death Review Panel was made up of some very intelligent and wise individuals who really deeply debated and talked about sort of how you balance risks, how you balance things like climate change, and again, sort of short-term mitigation measures like air conditioning units. So there was lots of conversation about all sorts of things, and I know that we are going to be moving in the right direction.
Justine, do you have a follow-up?
I do, thanks. The report talks about the number of times there were people on hold for 911 for more than 30 minutes and waiting for a maximum of the amount of time they were waiting for paramedics to respond. Can you give us the actual maximum number of minutes people waited for 911 and then maximum wait time for a paramedic to respond?
I'm afraid I don't have that information today, but you should probably ask the people that sort of have that information, BC Emergency Health Services, as opposed to me. What I do have is median times, and I've shared those.
Our next question today is from Jen St. Dennis, the Tyee.
I just wanted to get a little bit more details about, there's an emphasis on wellness checks, on checking up on people, and then if they're struggling with the heat, taking them somewhere, like taking them somewhere like a cooling center maybe. I'm not sure if hotel rooms might be an option, but I'm not seeing a lot of details about like where those places would be that you would take people, and whether we would, want to have an emphasis on having cooling centers open 24 hours a day, which we did not have during the heat dome. So is there anything you can tell me about maybe things that are going on behind the scenes, maybe with the UBCM about that?
Again, a really good question. And at the end of the day, when you have a high-level death review panel, you look at all the data that you have and you discuss the kind of things that need to be done. Do you actually do them in that day that you actually meet together and you subsequently write the report? No. What you do is you offer a roadmap and you offer thoughts so that people can actually take those and run with them. One of the thoughts that we offered was not only that do you need cooling to happen, whether it's in someone's home or whether they go somewhere else to have that cooling happen. We also offered the opinion from the death review panel that local communities know best how to do this. And what you've got to do is marry up resource and the wealth of knowledge that exists at the local level to make sure that you create the right effect in every community. And that effect is going to be different in every community. But the end point will be the same in that you will get cooling for people when they need it.
Jen, do you have a follow-up?
Yeah, I was just curious. I did take a look at what happened in Oregon and Washington, where they had fewer deaths, and it did seem like there was some lessons to be learned, especially maybe from those jurisdictions. Did you look at all at what they were doing down there in terms of communication, having cooling centers open 24 hours a day, that sort of thing?
I think yeah, we did, and I think there's some confounders here. One of them is that when this actually happened in real time, we put out an edict that reminded physicians in BC through the College of Physicians and Surgeons that these deaths, even though that, because you'll have noticed when I was talking about it that a lot of these folks that died and succumbed actually had lots of chronic disease on board. And so they had natural disease processes that were taking place all the time as well. We just confounded it by the heat that they were in, and we couldn't cool them. So in some other jurisdictions, people didn't have these deaths annotated as heat deaths. They may have been ascribed them to congestive heart failure, myocardial infarctions, renal failure, chronic obstructive pulmonary disease, and other natural disease processes. So I think that's what's made a big difference to the numbers that we had, and we did it purposely. We didn't do it so that we would look bad or good or whatever. It was done so that we could actually collect the right data. I remember the conversation that Lisa and I had at that time, and it was very much about, if we don't know what the magnitude of this is, we are never going to be able to work through exactly how we make our next response better. So that's the way that we looked at it. So I don't think the full story is known about Washington and Oregon.
Our next question today is from Brishti Basu, Capital Daily.
Hi, thanks for my question. There's a section of the report that talks about how many people are needed to access healthcare up to 30 days before they died during the heat wave. Has there been a count of how many people needed to access healthcare but couldn't?
Sorry, Brishti, you were cutting out there. Could you try texting your question to the number that I provided earlier, 250-216-9890? And while we're waiting for that, we'll move to our next question, which is from Jeremy Nuttall, Toronto Star.
Yeah, I'm wondering, I'm reading this and it says, of course, there was a lag between the heat warnings and public agencies. And I'm sorry if this is in there, I just haven't had time to peruse the whole thing yet. Which specific public agencies are we talking about?
We were specifically vague about the public agencies because we're talking about all agencies. We're talking about local agencies at the local authority level. We're talking about the ones that everyone wants to talk about, BC Ambulance and their response. We're talking about emergency rooms. We're talking about every sort of agency that had anything to do with the response. We're talking about all of them.
Jeremy, do you have a follow-up?
Yeah. Will we get any more, detail down the road about how this improved coordinated response is being developed?
I should hope so. I mean, I think one of the things that we look forward to is that the recommendations are going to start becoming fleshed out. And as they start to become fleshed out, I think an important thing for all of us to think about is how we're going to evaluate the effectiveness of any of these recommendations being made real. And so I would expect that you folks sitting in this room and virtually are the ones that are going to hold our feet to the fire to make sure that we are evaluating in the right way, because that's what happens.
Our next question is from Mary Brooke, Island Social Trends.
Hi, thanks for doing this session today. I'm looking at your suggestion that there be an increase in standards in the building code for cooling. And just wondering, I mean, that would apply to new construction. What about all the apartment buildings, and especially out in the west shore of Vancouver Island, there are a lot of single-family homes that are actually built with suites in them, and a lot of these buildings don't have cooling considered at all. So I'm just wondering, would you be recommending to policymakers about funding to not just new construction, but to existing homes, whether they're owned by land, especially the ones owned by landlords, to make those improvements?
Yeah, I don't think it makes any difference who owns the building. I think what we need to do is make sure that, and recommendation 3 does this, it does exactly what you say. We have to make sure that there are, there's thought put about retrofitting and retro designing, into existing homes and spaces so that we can actually bring them up to code or near to code. I'm not a structural engineer, civil engineer, or a climate specialist like that, but there are sort of intelligent folks that have thought about this, and they think it's eminently possible, and they were a part of the panel.
Mary, do you have a follow-up?
Yes, a few times today you've sort of posed an either-or. Either we get fans to people in the case of a heat emergency, or we get them to a cooling center. And COVID technically isn't over yet, and there are always communicable diseases. And I'm just wondering, will there be an emphasis on some kind of program, and that means funding, to having enough supply of air conditioners and fans to get out to people, versus investing in the cooling centers, which may not be as safe?
Yeah, I think even the idea of risk and how you balance risks that are coming at you at the same time is something that we've got to get better at. And I think we've got to start looking at risk in a wholesome manner so that we sort of compare like to like. I think there was a lot of angst out there about COVID last year, and which probably unnecessarily caused people not to leave their homes and go to places where they could have been cooled. And so I think we're all responsible to do that. Pragmatism, I think, is one of the most important things that we should lean on here. We should do whatever it takes to actually make a difference to the greatest number of people. And if that in the next year or so actually means ferrying people to cooler places rather than actually giving them air conditioning units, then that's what we should do. An air conditioning units, I think this is being asked a lot, and everyone knows this, have a negative effect in terms of climate change. We know that. It's measurable. It's something that that science exists behind this. So what we don't want to do is eat away at our future by doing short-term measures that sort of seem to be the right thing to do. So I think we've got to balance all of those risks all the time.
We've received our questions from Brishi Basu from Capital Daily via text, so these will be your final questions for this morning. Her first question is, a section of this report tells us how many people accessed health care up to 30 days before they died during the heat wave. Is there a count of how many of those who died needed to access health care but couldn't because of a lack of timely and available options?
That'd be a really interesting data point, but I really don't know how we would collect that. I think you're making a point about sort of accessibility to primary care, which we know is a fact. And is an issue for a lot of British Columbians. I don't know how that featured into this, but I do know that a lot of people, 70% of them, actually had some sort of access to a health professional, a doctor, in the 1 month before they died. And I think going further, what we really got to do is leverage that. Once we've identified who the vulnerable people are in our community, maybe we should take an opportunity when we know that there is inclement weather of any kind coming along, that we can actually sort of use those interactions to actually try and do some preventative work with individuals to ensure that they're going to be looked after, or there's other people, that they have a personal plan, etc.
And Brishi's follow-up was, the report tells us a large percentage of the people who died during the heat wave had a physical or mental disability. How many disabled people and people with lived experience were consulted or made members of this death review panel?
Again, a really good question. So we did have one person that was falls into that category, was a part of the death review panel. And so, there was widespread consultation and a lot of thought given about sort of, the access issues that a lack of mobility or being disabled imposes on an individual.
That concludes today's event. Thank you, everyone, for joining us.